Phase 1B of vaccinations is now underway across our area, with events being held to get as many people as possible vaccinated against COVID-19. CBS's Shannon Lilly tells us who is eligible and how long it could be before you get your vaccine.
I think it's fair to say that Phase 1B is going as fast as we can make it go in public health, but it's not as fast as the demand clearly exists amongst our priority groups across Virginia.
As mass vaccination events for Phase 1B begins in the Commonwealth, more and more people will be rolling up their sleeves. But maybe not at the speed you thought. Policy Director Ruth Morrison with the Richmond and Henrico Health Districts says just because you're eligible doesn't mean you'll necessarily receive your vaccine today or the day after.
It does ask of all of us some ongoing patience.
And using a phased approach, that means health officials will vaccinate one population category at a time in order to organize the flow of vaccine to different groups of people. And part of that phased approach includes categorizing even Phase 1B. The first priority for this week includes teachers, especially in face-to-face exposure, frontline essential workers, and childcare workers, as well as those individuals who live in or work at congregate facilities and those who are 65 and older.
For all of these groups, the total population relative to the total availability of vaccine is not matched. We don't have as much vaccine as we have individuals who would be eligible in just those categories.
Morrison says for the most part, when it's your turn to get your vaccine, you'll be contacted, whether that's through your employer or your primary care physician. For teachers, she says health districts are working closely with school leadership in order to prioritize people who are most exposed or at risk. And even if it is your turn, not everyone will be registered to get vaccinated at the same event.
We have a certain amount of capacity for administering doses at different events. And so it's important that, we essentially kind of route people to different rooms, so to speak.
For those that are eligible under Phase 1B, but not included in this first rollout, like those under 65 with comorbidities or grocery store workers, Morrison says when you get your vaccine is completely dependent on the availability of supply. But health districts are working to make it happen as soon as possible.
So we truly understand the urgency here. And as doses become available, we will be speeding them to access for these priority populations in the phased approach.
Working for you, I'm Shannon Lilly, CBS 6 News.